My name is Stephan Windecker. I'm from Bern, Switzerland, and it's my pleasure to conduct this morning's interview here at the European Society of Cardiology meeting 2012 in Munich. And I'd like to introduce Jean Fajadet, who is the president of the European Association of Percutaneous Coronary Interventions. Welcome, Jean.
Welcome. Good morning.
Jean, maybe I can ask with the question that you describe whom EAPCI does represent, how it fits into the framework of the European Society of Cardiology, and maybe that you also elaborate a little bit on the number of memberships and so on.
Yes, thank you for this question and the interview. This gives an opportunity to talk about our association. The EAPCI, the European Association of Percutaneous Coronary Intervention, this is a young association. It was built in 2006, so only 6 years ago. It was a joint venture of the Working Group 10 of the ESC and the EAPCI. At present time, this association is the large dominant association of our interventional community in Europe. We have concerning the membership. We have passed today, at present time, more than 4,000 members. So it's a continuous increase of membership since the origin of the association. And I think it's concerning the membership is really a good success. What this association represents is really the representation, the sum of all the different working groups and national society in Europe. We have a representation of more than 45 national working group and national societies. And you could see this in the distribution of the membership with members coming from the ESC national societies, national countries, but also coming from countries affiliated to ESC. And there is some members coming from really abroad, from country non-affiliated.
So this is quite impressive, the achievements within a short period of time, and that EAPCI indeed has become the second largest association within the European Society of Cardiology. Now, from your perspective, what do you think are the most important achievements which already have been done within the past 2 years for the association?
So for the association, first of all, we have to say that we have a chance to be the president and you, the president-elect of a very, very active association. First of all, of course, our national annual meeting, EuroPCR, with more than 12,000 attendees each year at this meeting in Paris. The second is that we have already endorsed last year the second meeting, the PCR London Val, which is this year the second official meeting of the association. And maybe we could talk about, as a co-chairman of your PCR London Val, about this meeting. The great achievement, certainly, in this year, 2012, our textbook in interventional medicine is a fantastic textbook. It's a lot of work, 4 volumes. We have covered all the topics in interventional, in intervention, cardiology, coronary, battle extracoronary. Really, this textbook is in paper format in 4 big volumes, but also could be found on the web, and he has an iPad version.
This is really impressive, the achievement within a very short period of time, namely, as you alluded to, the textbook which was a joint effort of EAPCI with EuroPCR. And I think it is also impressive to see the interactive possibilities, not just reading the text, but also having the possibility to review picture material on a line. I think one of the strengths in the collaboration collaboration of EAPCI and EuroPCR is certainly education, and there has been an additional effort together with the European Society of Cardiology to initiate the ESCAL platform. Yeah. Do you want to elaborate on this new educational possibility?
Absolutely, and maybe before moving on the ESCAL platform, we have to talk also, and for us, we are really proud of that, of our journal, Euro Intervention Journal. First impact factor this year, 3.3. And so really we have to thank Patrick Sarais, all the team for this great job. Concerning the platform, education, ESCAL platform, thanks to the effort of Lino Gonçalves and all the team in the ESC house, this platform I believe will become really a milestone in the education concerning interventional cardiology. EAPCI plays a major role in the interventional part, and we can say that today more than 40 chapters have been done, a lot of MCQs. In this platform we can follow the three major ways with the knowledge, the skill and the professionalism. I think it's the first time when we see something like that offered to the fellows, but also for all interventional cardiologists, all doctors or cardiologists for continual medical education post-university. I think it's a great achievement.
Yes, maybe we can talk about what may be the most important event for the association once a year. That is the specialized congress of EAPCI together with EuroPCR taking place on an annual basis in Paris. And maybe you can describe a little bit the structure and the format of this very successful venue.
Yes, you know, now it's, I think it's more than 20th anniversary of this meeting. We started 20 years ago with Jean-Marco. It was in 1989 in Toulouse. At that time, there was 125 attendees. Today, and since the last 4 years, we have an average attendees of more than 12,000 people. It's the first, it's the leading meeting, worldwide meeting in interventional cardiology. When I say interventional cardiology, it's not only cardiology. We have currently 4 different tracks in the meeting: interventional cardiology procedure, intervention for peripheral artery disease, intervention for structural heart disease, valve and all the mitral and all the structural disease. And the 4th track is renal denervation for resistant hypertension or heart failure. In addition, we have to mention that there is a really beautiful program for nurse and technician. And when you look at the attendees of nurse and technician, it's close to 1,000 now in this meeting.
So this is also an excellent opportunity for cross-fertilization and collaboration with other associations and other health care professions. Maybe one last question at the end. We all depend on the coming generation and young cardiologists with an interest in our specialty. Can you indicate what are the special opportunities for young people within our association?
Absolutely, and this is new is really recent in our association. And with you, Stephan, we think about that for the future of the association, for the future of interventional cardiology, and we particularly take care of the young fellows. And we create in our association a new committee 2 years ago, which called New Initiative for Young Cardiologists. And this young group, they have their own logo with inside the logo of the association, are really active. Really, they propose a lot of new ideas, new proposition, and it's really a new blood concerning the ideas of education for the association. In addition, they are connected with Cardiology for Tomorrow of ESC. And I know that there will be a very close link between the young group and the association. If I can, I have a question for you, Stephan, because we talk about our annual meeting, EuroPCR, but you could talk about the second annual meeting of the association, PCR or non-valve.
Yes, certainly. I think the association has recognized that structural heart disease is one of the very important areas with an incredible development and potential. So together with EuroPCR, we organize now the course PCR London Valve, which was originally initiated by Martin Thomas and now is a joint venture. And within a very short period of time, only 2 years, it actually has become the largest course of this kind globally and finds a lot of attraction. The real thought of this course is to show practical tips and tricks for interventional cardiologists interested in this field, but it also nurtures the idea of the heart team that is in close collaboration of cardiologists with other specialists, namely cardiovascular surgeons, imaging specialists, geriatric physicians, all kind of specialties involved in the care of patients with structural heart disease. And I think we want to develop this further, and we are very proud to have this as part of the EAPCI, EuroPCR family.
So the last question maybe of this interview, you will succeed to me as a president of the association. You are currently president-elect. And what will be for you the future of the association inside Europe, the relationship with European Society of Cardiology, relationship with the other association? We have 5 associates now with the 6th one with acute care. How do you see this, link, this network between association, European countries inside the ESC Central?
I think the major theme needs to be collaboration and integration. We are a very fast growing association, and the breadth of interventions and opportunities is very wide. And there are certain risks, but I think the opportunities prevail. And I would think notably the possibilities for collaboration with other associations and societies, namely those of cardiovascular surgery as it relates to interventions in the field of coronary artery disease as well as structural heart disease, but other associations like the societies for hypertension and also the working groups of valvular heart disease. These will be major focus and efforts on our part to integrate in our efforts to educate and disseminate knowledge.
Okay, thank you. So to summarize, EAPCI, our association, is today in really good shape. We have 4,000 members, a lot of activities, and the future looks good.
Thank you.